Hi everyone, I'm going to present on pediatric fractures. So you have your complete fractures, which I'm not really going to go through because they are the same as adult fractures. Incomplete fractures, which include buckle, green stick and bowing fractures, and then all the Salter-Harris fractures. So in terms of incomplete fractures, it's where the fracture line doesn't go completely through the bone or the fracture line isn't visible at all. So you've got intact periosteum on at least one side of the bone. The mechanism of injury is normally a fall on an outstretched hand or a fall from a height. So the first one, you can see, the buccal fracture, you have the bulge on the concave side or the compressive side. There's no proper break in the periosteum, but there is a disturbance of the periosteum. In the green stick fracture, the break is on the other side, so the convex side, and you do have a break in the periosteum. And then this picture's slightly, so normally the buccal fractures are in the distal radius at the junction of the metaphysis and the diaphysis. In this picture it shows it in the middle, but that's just one thing to keep in mind in terms of differentiating a buccal from a green stick fracture. And then the bowing fracture, there's actually no disruption of the periosteum itself. It's just a change in angulation. So having a look at some images, this is the torus or the buccal fracture here. You can see the disruption there. The middle one is a green stick fracture, so you can see the disruption there and there. And then the bowing fracture, you can see that there's no disruption to the periosteum, but there is an angulation. In terms of Salter-Harris fractures, I know we've done these a million times before, but the first one, so your S or your type 1 is separation at the growth plate. The type 2 is separation just above the growth plate, and type 3 is just below the growth plate. 4 is through both above and below, and 5 is that complete kind of compression and crush injury of the growth plate. So it's a facile fracture, and it usually occurs in kids around their kind of beginning of puberty when they're having a growth spurt, so 11 to 12 years in girls and 13 to 14 years in boys. It commonly occurs in the distal radius and distal humerus, so they're the growth plates that we talk about in those main bones. So you can have a disruption of growth particularly if it's those type 3, 4 and 5, because you're disrupting that growth plate. You can end up with a different length of the limb, so sometimes different things have to be done to the other growth plate if they do end up having a length discrepancy. The younger patients are more likely to experience growth arrest. In the older ones, sometimes it's not as much of an issue. Apparently you can have excessive limb growth, which is a very rare side effect. I found some x-ray images because I feel like sometimes they're quite difficult to see them all, but I found them quite, this one was quite a clear example. So you've got type 1, that complete separation. Type 2, above the growth plate. Type 3, below the growth plate. Type 4, through both. And type 5, which you can sort of see the crush through the entire growth plate. In terms of management, so for types 1 and 2, they're less severe and your growth plate is less at risk of kind of long-term consequences. So it's normally treated with a closed reduction and immobilization, and they're 3 and 4, or severe types of 1 and 2, are usually treated with an open reduction, and you need to realign the joint surfaces and normally use internal fixation to hold it all together. Type 5 is very much dependent on the injury and the age of diagnosis, but will usually always need an open reduction and internal fixation. In terms of other pediatric fractures, there are kind of a few bones that are well known for pediatric fractures. So a distal radius, a clavicular fracture. So the weakest point in the clavicle is that middle third, which is where it's most likely to fracture, and a supracondylar humeral fracture, so that's that one there, which is also common in kids. And that is all.